Doris recently had a mini stroke. Doctors at the emergency room could manage her condition. She is safe and ready to go home. A few days after, she comes to her family doctor because she needs blood thinners to avoid having a new stroke. The doctor explains to her the different blood thinners to choose her best option. But this is not an easy task due to the multiple factors to consider. That's why we've created Thinning Your Choices.
Great, thanks. So Thinning Your Choices, it's a web-based application that we've created that incorporates evidence-based information along with patient preferences to create a better shared decision support. So we'll walk through how this will look for Doris as she meets with her primary care physician, how she would benefit from this tool. We start by entering Doris's medical information on her stroke risk factors and bleeding risk factors, as well as other medical factors that would affect treatment choices. Once this is entered, identifying those risk factors, it will create the treatment options based on this information. In addition to which, you're then able to visualize how these treatment options compare across the stroke risk and bleeding risk associated with these treatment options in her case. We are then able to move into the novel aspect of this type of application, where we look at patient preferences, identifying the key issues that affect Doris's preferences around how she manages medications, and applying an order of importance. In this case, identifying that the need for blood testing, as well as preventing another stroke from occurring, and the worry about bleeding risk are her top choices, and how that will inform her treatment options. Once this is submitted, it's incorporated into the treatment options to allow you to identify what's the optimal choice for her based on this information, and an easier way to understand how that treatment decision can then be made, as well as to document how that decision is made. This application will allow for better shared decision making and allow for better decisions that will allow for a reduction in stroke as well as bleeding complications associated with patients who need to take these blood thinners. At this point, we need to, in order for this to succeed, number one, identify some strategic partners that will help us in both implementing as well as developers to help us to complete the project. This is also an opportunity for us to identify using such an application that will combine both evidence-based information as well as patient preferences into shared decision-making that can be seen as a positive factor for a lot of other health conditions such as diabetes and cancer care. Thank you.
So a good question. I think what we've identified is that this would be, well, primarily the primary care physician or care provider would be the one who would introduce this tool into their use. It is actually with the patient to allow for better decision making. So while the primary customer would be primary care physicians and other care providers, I do think it's as part of that shared information and how they make those decisions. So yes, patient as well.
So this is done at point of care?
And expected to be done at point of care, so having that simple ability to sort of use it right at in the office to help with that decision making.
And is it integrated with the electronic patient record, so you don't have to double entry and it's just all that data that you have on your first screen is just pulled automatically?
Well, it's not at this point in a position where you could enter that automatically. It's a kind of very simple medical information that needs to be entered, but also an ability to create a way for it to be shared, either that it's incorporated into the health record or also shared with the patient so that they can have a copy of that as well. But the primary elements are simple enough that I think it'll still allow for efficient patient management.
40 seconds left.
So what are the next steps after the proof of concept, to prove the concept that you have from the team?
I think from the team's perspective, while we want to move forward with this, there's certainly a willingness. The strategic partners, I think, are going to be necessary for us to complete the prototype. So I think this lends itself to partners such as Heart and Stroke. I'm the medical director for anticoagulation management services here in the Calgary zone, and I know that this is the kind of work that will improve outcomes and provide good quality and safety. And so I know some of the partners, even within Alberta Health Services, that will support that as well. But we do need some assistance with some developers, I think, in order to incorporate some of the key elements that still need to be embedded.
Perfect.